Hey everyone, today I'll be talking about placement of ECG leads. We need to understand that there are two types of leads. We have the limb leads meant for the vertical activity, and then we have the chest leads which are meant for the horizontal activity. If I talk about the limb leads, they are further divided into bipolar and unipolar. Bipolar limb leads are lead 1, 2 and 3, and the unipolar limb leads are AVR, AVL and AVF, wherein A stands for augmented. If I talk about chest leads, we have 6 chest leads, namely V1, V2, V3, V4, V5 and V6. First, I'll be talking about the bipolar limb leads. Now look at this diagram of Ithovan's triangle. From here, you will easily understand the connection of bipolar limb leads. In lead 1, the negative is attached to the right upper limb and positive is attached to the left upper limb. Negative to right upper limb and positive to left upper limb. This is negative, this is positive. So the direction of flow of current is like this. Vertical impulses will go like this because our heart is tilted at a particular angle. Both the vectors are making a particular angle which is acute. So we will see a deflection in which P and QRS will come out to be positive. In lead 2, the negative is attached to the right upper limb and the positive is attached to the left lower limb. This is negative, this is positive. This would be the direction of current and this is the direction of impulse. Both are in same direction. So again, P and QRS will be seen as positive. In lead 3, the negative is attached to the left upper limb and the positive is attached to the left lower limb. This is negative, this is positive. This is the direction of current and this is the direction of impulse from heart. So again, P and QRS will be seen as positive. Now I'll be talking about the unipolar limb leads. In unipolar limb leads, this letter will tell where the positive will go. In first case, AVR, R means right upper limb. So the positive will go to the right upper limb. Negative is connected to a midpoint between the remaining two limbs. In this case, midpoint between the left upper limb and left lower limb. This is negative, this is positive, this is negative. So the flow of current is like this and the direction of impulse is like this. Now both the vectors are in opposite direction. So P and QRS is seen as negative in AVR, negative or say reversed. Second case is AVL. L means left upper limb. Positive is connected to left upper limb and negative is connected to a midpoint between the right upper limb and the left lower limb. This is negative, this is positive. This is the direction of current and this is the direction of impulse. Both make an angle of 90 degrees and hence there will be no deflection. So P and QRS are not seen or say seen as 0. If I talk about AVF, F means for easy understanding, I'm saying foot, but we know that we mean left lower limb. So the positive is connected to the left lower limb and negative is connected to a midpoint between the right and left upper limb. This is negative, this is positive, this is the direction of current, and this is the direction of impulse from heart. So P and QRS will again be seen as positive. Now, next I'll be talking about is the chest leads. We have 6 chest leads. V1 is placed in the 4th intercostal space on right side. So let us count 1, 2, 3, 4. V1 is placed in right 4th intercostal space along the sternal border. Adjacent to the sternal border. V2 is placed adjacent to the sternal border in the left 4th intercostal space. For a while, forget about V3. Focus on these 3 lines I have drawn. The first is the mid-clavicular line on the left side. Then we have the anterior axillary line of the left side, and the third line is the mid-axillary line of the left side. V4 is placed in 5th intercostal space in left side along the mid-clavicular line. V5 is placed in left 5th intercostal space along the anterior axillary line, and V6 is placed in the left 5th intercostal space along the mid-axillary line. V3 is placed somewhere between V2 and V3. So these were the placement of different leads of ECG. I hope you could understand this video. If you like this video, make sure to like, share and subscribe. Thank you.